Hello everyone, welcome to Patho Excellence. Today in this microscopic description to diagnosis series, we are going to discuss an important morphologic type of necrosis which is fat necrosis commonly seen in acute pancreatitis. So what is necrosis? It is the cell death which is due to injury to cell and which is irreversible. So here this is a slide of fat necrosis. Now acute pancreatitis, it is characterized by reversible pancreatic parenchymal injury, inflammation and has many causes including toxic exposures. Example alcohol, pancreatic duct obstruction like biliary calculi, some inherited genetic defects, vascular injury and infection. The male to female ratio is 6:1 in those with alcoholism and 1:3 in patient with biliary tract disease. Gallstones are present in 35% to 60% of acute pancreatitis cases and it causes gallstone pancreatitis in about 5% patients with gallstone. This is the gross specimen of pancreas. This is a type acute hemorrhagic pancreatitis. Here, this section shows cut surface of pancreas. This is normal, viable, grayish pancreatic parenchyma. This yellowish peripancreatic fat, and this is hemorrhagic and inflamed pancreatic parenchyma. This whitish deposit, it is chalky deposits of saponified fat, and here we can see this is the pancreas surrounded by fat, peripancreatic fat, and this is injury to pancreas which is leading to fat necrosis. This is the slide of fat necrosis. Now, here in this section, this are acini which is viable in nature. Here, this portion shows fat, and in between this fat, there is inflammatory cell infiltrate and congested vessels. These are the congested vessels, inflammatory cells, and this is area showing fat necrosis. Fat necrosis is basically a host cell appearance of adipocyte. This is fat necrosis. So by definition, there is a fat destruction caused by release of lipase enzyme from damaged pancreatic acini cell. And this fat necrosis is common in acute pancreatitis. So this is a portion where you can see viable pancreatic acini. This is adipose tissue, and in between this cell shows inflammatory cell infiltrate, hypertrophied nerve fibers, and this is area of fat necrosis. So pathogenesis includes there is a lipase released from the damaged fat cell membrane. It damages fat cell membrane, and there is triglyceride split into free fatty acids. Now this free fatty acid combine with the calcium and form chalky white soap-like deposits, which is called fat saponification, and it triggers inflammatory reaction. So this is normal or viable pancreatic acini. This is fat necrotic area and surrounding necrotic part. So these are the pathways how acute pancreatitis develops. So duct obstruction or acinar cell injury or defective intracellular transport will lead to acinar cell injury, and this lead to enzyme activation and release, mostly protease and lipase and elastase, which ultimately lead to fat necrosis, injury to parenchymal cells as well as vessels damage and hemorrhage. So microscopically, these are the host outline of fat cell, which is called necrotic adipocytes, basophilic calcium deposits, inflammatory infiltrate in between these fat cells, and hypertrophied nerve fiber. There are two types of morphology in acute pancreatitis. So this is acute interstitial pancreatitis, where we can find mild inflammation, interstitial edema, and focal fat necrosis, which is triggered by lipase activity leading to saponification. Initially, neutrophils are present and then macrophage and lymphocytes. This is acute necrotizing with marked hemorrhage, coagulative necrosis, and this is intravascular thrombi. And so this is again areas of fat necrosis with hemorrhage. Calcification early and in a extensively fat necrosis is there, then it is characterized by lipid-laden macrophage and foreign body giant cell. This is fat saponification, where blue granular deposit of calcium along with the fat. So this is high power view, where you can find post outline of adipocyte, which is bluish granular deposition of calcium, that is called saponification. So in summary, fat necrosis, it is a enzymatic necrosis. Key mechanism, it is the lipase which induce fat destruction. Diagnostic clue is chalky white saponification area, and histologically necrotic fat, calcium deposition, and some inflammatory infiltrate. So this is about fat necrosis. Thank you. Stay tuned, and please like, share, and subscribe this channel for more such cases.